Our topic for today is medication safety. So, for the helpful pointers, first is use generic names. It is difficult enough familiarizing oneself with all the generic medications in use and can be almost impossible for the nurse to remember all the related trade names or brand names in the market. To minimize confusion and simplify communication, it is helpful for the nurse to know and use generic names. Learn and practice thorough medication history taking. It should include the name, the dose, the route, frequency, and duration of every drug the patient is taking. Inquire about recently seized medications. Ask about over-the-counter medications, dietary supplements, and complementary medicines that might affect the drug interactions. Then use memory aids. A simple example of a memory aid is a card with all the names and doses of medication that may be needed in the situation of a cardiac arrest. Then, communicate clearly. It is important to remember that safe medication use is a team activity that also includes the patient. Clear and ambiguous communication will help to minimize assumptions that can lead to error. And develop checking habits. An example of a checking habit is to always read the label on the ampule or vial before drawing up the medication. If checking becomes a habit, then it is more likely to occur even if the clinician or the supervisor is not actively thinking about being vigilant. Some useful maxims regarding checking. Unlabeled medication belongs in the bin. Never administer a medication unless you are 100% sure you know what it is. And encourage patients to be actively involved in their own care and the medication use process. Educate your patients about the medication and any associated hazards. Communicate plans clearly with patients. And lastly, report and learn from medication errors. Discovering more about how and why medication errors occur is fundamental to improving medication safety. Thank you for watching.